I start smoking around 17, 18, which is the average age for a young adult to start smoking according to WHO statistics. It was in the 60s and smoking was cool, was sexy, was well accepted. Everybody smoked. There were advertisings of smoking everywhere. I smoked for 40 years. And in the last 10, I smoked 3 packs a day, which is really classifying me as a heavy, heavy smoker. And one day, suddenly, coming from nowhere, I had a terrible chest pain. I was alone in Brussels for a meeting in my previous life, and I was really terrified. I thought it would be my last day, alone in winter, in a room hotel in Brussels. It was what I had an experience, a terrifying experience. And then I arrived to Portugal. I got straight to my doctor. And the diagnostic was, may I say, was brutal. I had a choice: either I stop smoking, or in few months or weeks, I would have to depend on oxygen to breathe. In the best of the situations, in the worst, I can have lung cancer and, of course, die. So I started a program to quit smoking, with a lot of help, patches and drugs and things like that. In that time, there was only one drug in the market, and I take it for 6 months. In the end of 6 months, I finished my career as smoker, and never, I quit for good. They help a lot because they were very, very clear about my situation. They explain in lay language what I had and what I have to do, and if not, what will happen to me. Very, very plain, very clear language, lay language, completely lay language. And they were very assertive, but at the same time, they were helpful because they explain and they offer the solution at the same time. So it was very reassuring. And that doctor who helped me quit smoking nowadays is a very good friend, because he helped me so much. He gave me his mobile phone, so I can call him anytime, the day of the night. In the beginning I called him several times during the week. Sometimes he was in holidays in the other part of the world, but he pick his phone and answer me and help me. Without him and without the team who work with him, it would be impossible for me to quit. I was lucky because in that time there is not no e-cigarettes or things like that, because I'm not sure, and I must very straight, very candid about this. I'm not sure if when I quit smoking 16 years ago, if these kind of devices were in place, if I would quit. Three or 4 years ago, I was in a meeting, and it was extraordinary because someone asked, how many of you, or doctors, how many of you have training for help people quit smoking? 3 or 4 hands raised, on only 3 or 4 hands raised, which is terrible because we are dependent in the first line are dependent on doctors, because it's the first place we arrive as doctors asking for help and for quit smoking. So please be trained, ask for training in your medical schools, in your scientific societies. Please ask for training to help us quit smoking. The same for the other healthcare professional. Ask for help. Nurses, psychologists, nutritionists, everybody. We do need you, but we need you to be trained. If you have appointments for tobacco session in your hospital or in a healthcare center, please do it at time which is convenient for people, not at 12 o'clock or at 2 o'clock in the afternoon. In the end of the day, on Saturdays, because if people is working, the perfect excuse for not to go to the appointment is to have an appointment at times he or she is working. And believe me, we don't need much excuses to avoid help or quit smoking because we like smoking.